Welcome back at 8:13. There is a new treatment that could be a really big news for people who suffer from food allergies. The FDA recently approved the first drug for children and adults to, I shouldn't say stop, but make allergic reactions less severe in the case of accidental exposure to foods that you're allergic to. Dr. Reena Mehta with Uptown Allergy and Asthma is here to explain how the drug Xolair, which has already been on the market for other uses, could now be used to help people with these severe allergies. Good morning. Thanks for being with us.
Good morning. Thank you so much for having me.
So I was telling you in the commercial break, Xolair people at home might also be familiar with, but what is it typically used for?
Okay, so Xolair, otherwise known as omalizumab, has actually been on the market since 2003. We have been using it for years for asthma therapy. We also use it for chronic hives, and we also use it for chronic sinus infections with nasal polyps.
And that's an injectable, is that
It's
correct?
an injectable medication that's usually dosed once every 2 to 4 weeks. Often it's weight-based. And so it's something that we're very familiar with as allergists. We feel very comfortable with its use, but now we're very excited about its new indication for food allergy.
And so tell us about this study. How did they figure this out and what did it find?
So this is a new study that was published in the New England Journal of Medicine, where they looked at children and adults ages 1 and older, looking at those with multiple food allergies. So things like peanut, milk, egg, tree nut allergy, and what they did was they put them on 16 weeks of therapy, so 4 months of omalizumab or Xolair therapy, and what they did was then they challenged them to those allergenic foods. And what they found was that it reduced the threshold of having a severe allergic reaction. So those that were peanut allergic, after 4 months of therapy, were actually able to tolerate 2.5 peanuts without a severe systemic reaction.
Which is game-changing, life-changing, because people with severe peanut allergies can, I mean, not to be funny, but they can barely be in a room with peanuts in some cases.
It can be very severe. And so this is not saying that this is making your food allergies go away. This is a medication. So what it's doing is it's raising that threshold of having a severe allergic reaction. So if you're somewhere and there's cross-contamination with the food that you're allergic to, what it's saying is that you're unlikely to have a severe allergic reaction, or you may not have a reaction, but it's not saying go and eat that food. It's not replacing your EpiPen. It's basically saying that this is a really safe injectable medication so that you don't have to be as worried. It offers a layer of protection.
Typically, if you or your child has a severe allergy, you're pretty careful. You eat at home a lot because there are fears of cross-contamination, which also means the idea of going to restaurants in town or traveling domestically or internationally can be difficult because you don't know what's in food necessarily. But again, this could at least give you a little bit more freedom, a little more leeway, but you'd still have to travel, of course, with those EpiPen type medications,
Absolutely.
right?
So I just enrolled a 5-year-old who has milk, egg, and tree nut allergy.
Wow.
And the family is really excited about the therapy because they want to travel this year. They're going to Italy. They're going skiing. And they don't want to have to be so nervous all the time of what if something gets into my child's foods. They want to be able to enjoy their vacation. They want to be able to not have that anxiety. And so they still are going to travel with their EpiPens. They're still going to avoid the food. But this really has been a safe product that's come out that we've studied for years that really can offer that layer of protection.
So the study is done. What are the next steps? I know people at home who are in this box, which is a lot of people. What are they? I know they're like, well, what do we do? How do we get involved in this? What are the next steps now?
So it's shared decision making. I mean, most of those people already probably have an allergist.
Right.
And so it's talking to your allergist to see if you're a good candidate for the medication. So it's ages 1 and up. So we're not doing it in infants, but it's basically measuring your blood levels to say, okay, how allergic are you to this medication? How many food allergies do you have? Are you ready for this type of therapy? And then enrolling for the drug and seeing, if your insurance covers it. So, it's a pretty safe product. It showed after 4 months of therapy this protection. However, you have to kind of decide if it's the right fit for you, and that's when you talk to your allergist to determine that.
Well, Dr. Mehta, you came in here with the game changer this morning. I'm sure people are going to be calling their allergists left and right. Thank you so much for sharing that with us this morning.
Thank you so much for having me.